السلام عليكم ورحمة الله وبركاته، وأسعد الله جميع أوقاتكم بكل خير. بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وبعد. Our lecture for today is about brucellosis for the 6th-year medical students. The importance of brucellosis is number one, it is an endemic disease in our area. Number two, it is considered one of the causes of pyrexia of unknown origin or pyrexia without focus. The third one, it looks that there is underdiagnosis of cases of brucella here in Gaza Strip, and maybe some doctors are not keeping in mind that this disease is available in this area. Regarding to the objectives for today, every student of you by the end of this lecture will know about the brucella organism, the epidemiology of brucellosis, pathogenesis, risk factors, clinical manifestations, diagnosis, treatment, prognosis, and he will know a recent study about this disease in our area, and at last he will know the prevention of this disease. Introduction. Brucella is considered a major public health problem worldwide because all the animals, either the sheep or the goats or all these animals, are available everywhere, and this disease is considered zoonotic disease transmitted by direct contact with the infected animal. That's why there is occupational risk among the adults who are working in this field. Again, brucellosis in children is food-borne mainly, and it is associated with consumption of unpasteurized milk product. And it is also a potential agent for bioterrorism. What is the etiology, or what about the types of brucella organism? We have Brucella abortus in cattle, Brucella melitensis in goats and sheep, Brucella suis in swine, and Brucella canis in dogs. The Brucella organism is a gram-negative coccobacillus. It is small, aerobic, non-spore forming, and non-motile. The epidemiology. This disease is available worldwide, but it is more prevalent in the Mediterranean area, which is our area, the Arabian Gulf, and this is very common there, and in India. In children, Brucella melitensis is more endemic. That one is for goats and sheep because of the use of unpasteurized milk. Exposure to animals or animal products will cause this disease. The pathogenesis, usually the route of infection is through the skin cuts or abrasions, through the eye conjunctival sac, through inhalation of infectious aerosols, and ingestion of contaminated meat or milk products. This picture shows that regarding this cow, and there is abortion of the cow after this cow is having brucellosis, causing abortion to the cow. So this is highly infectious for those people who are taking care of this cow. What are the risk factors for brucellosis? There is a nutritional, if there is a nutritional problem with the person, the immune status of the child, the route of inoculation of the organism, and the species of Brucella, because the virulence is different. And here regarding the virulence, the Brucella melitensis and the Brucella suis are more virulent than Brucella abortus or Brucella canis. The organism is facultative intracellular pathogen, and this is very important because once that the organism will enter the cell, going to the reticuloendothelial system, it will spread in all the body, including the brain. The organism survives and replicates within monocytes and macrophages in the reticuloendothelial system. The infection with a Brucella organism will cause granuloma, specifically in the liver, in the spleen, in the lymph nodes, and in bone marrow. What are the clinical manifestations of brucellosis? First of all, this will help us to take the history of the animal and food exposure of the person. And again, there will be symptoms as we mentioned later on. But the symptoms are usually non-specific. The incubation period is 2 to 4 weeks. There is a classical triad for the complaint of brucellosis. There will be fever, arthralgia or arthritis, and hepatosplenomegaly. By this triad, we have to suspect in brucellosis, and we have to do the investigations to prove the disease. But some people will present with fever of unknown origin, as we mentioned in the start of our lecture. What are the expected other associated symptoms? We told it is vague sometimes, and some of the symptoms may be non-specific. So there may be abdominal pain, headache, diarrhea, skin rash, night sweats, sweating like in TB, weakness and fatigue, vomiting, cough, and pharyngitis. But the common symptoms in children are refusal to eat, generalized fatigue, refusal to bear weight in the lower limb, because this is because of the arthralgia or arthritis, and there will be failure to thrive. Yani once in children you will find these symptoms, you have to suspect in brucellosis and you have to do the investigations. As we mentioned, the usual physical signs, there will be hepatomegaly, splenomegaly, arthritis or arthralgia, fever. The pattern is very widely. You know this brucellosis, I want to tell that and to remind you that the brucellosis in Arabic, الحمى المالطية. So you have to know the name in Arabic also as a doctor. What are the bones and joints affected? Because we called that there is hepatosplenomegaly, fever, arthritis or arthralgia. What are the joints? The most common joint affected is the ankle joint. So there will be limping. The child is coming to you limping. The second joint is the sacroiliac joint. The hips and the knees can be affected. There will be CNS invasion in 1% of cases. This is Brucella encephalitis. Neonatal and congenital infections have also been described. And that's why the mode of transmission is many. All of the things, whatever you expect, you will find the mode of transmission, even transplacentally and probably with blood transfusion, as it is mentioned here. So it is transmitted transplacentally through breast milk and through blood transfusion. So how we reach the diagnosis for brucellosis? We have to take the history thoroughly about exposure to animals or ingestion of unpasteurized dairy products. We have to, that's why in your history, as we taught you before, we have to ask in the social history exposure to animals and whether there is animal pets beside the house or beside the building or inside the house. You ask about animal pets because this is zoonotic disease. And again you ask about exposure or ingestion of unpasteurized dairy product, especially milk and cheese. And some of the people who are selling cheese or milk, they will not be through companies or factories, known factories. So you have to be sure that it is not contaminated, and it's better not to buy except the milky products which are known. The source of these milky products is known to you. There may be thrombocytopenia, neutropenia, and anemia. That's pancytopenia. But this one, it is not characteristic for brucellosis. And once you find even 2 of these, you have to suspect in leukemia in children and in septicemia. So this is not specific for brucellosis, but you have to think in brucellosis when these things are there. But usually the definitive diagnosis is by culture, either of blood, bone marrow, or other tissues. But the usual test for that, usually antibody test, we test for that. When you will ask the culture, don't send the request for blood or bone marrow cultures. You have to write, you make culture for brucellosis, because there is special culture for that. Otherwise, it will be negative. But regarding the culture result, it will be delayed. We cannot wait until the culture result will come, because isolation of the organism still require 4 weeks. And this is, long period for symptoms and serious problems. Usually we make diagnosis by serum agglutination test, which is used to detect antibodies against Brucella type. Usually when it is positive when it is 1 to dilution 1 to 160 or more. What are the differential diagnoses for Brucella? These diseases, which share in the same symptoms and signs, like cat scratch disease, typhoid fever, fungal infections due to histoplasmosis or blastomycosis. Tuberculosis is a strong differential diagnosis, and we have to differentiate. As we mentioned before, there is night sweating, could be hepatosplenomegaly, and tuberculosis can even infect the bones and the vertebral column and all the bones. That's why the triad will be there in tuberculosis. Fever, arthralgia or arthritis could be there, and hepatosplenomegaly. Again, rickettsial disease, which is also intracellular parasitic or intracellular organism, and Yersinia. What is the treatment for brucellosis? Doxycycline or doxycycline is the most useful antimicrobial agent. Doxycycline. And you know we have problem with the doxycycline and tetracycline group, which is pigmentation of the teeth of children, especially if it is given for long course for children below 8 years of age. That's why we have to think in other medication. It will be more effective if you give combined therapy, doxycycline plus aminoglycoside like the gentamicin or streptomycin. This will decrease the relapse rate, and this will be clear in the study. We will show it to you at the end of the lecture. Here the therapy for children, as you see, more than 8 years. So the doxycycline, usually we give it in the dose of 2 to 4 milligram per kg per day, but we don't need to reach the maximum dose, which is 200 milligram per day. It is given orally and should be given 46 weeks. That's why at least you will give it 4 weeks. And this is, you know, long period. So mostly there will be, the compliance will be poor, except if you are giving good communication, good health education to the people, to be sure that they will take the treatment for more than 1 month. We told that here the first modality of treatment is to combine rifampicin with the doxycycline. Rifampicin will be given in the dose of 15 to 20 milligram per kg per day, but the maximum dose will be 600 to 900 milligram per day. Again, it is given orally for 4 to 6 weeks. So better to give this combination for 4 to 6 weeks. The second option or alternative for that, again, to give doxycycline plus we mentioned aminoglycoside, either streptomycin or gentamicin. So the dose of doxycycline mentioned up, but the streptomycin is given at 20 to 30 milligram per kg per day, and the maximum dose is 1 gram per day. And the gentamicin is given 3 to 5 milligram per kg per day, either intramuscular or intravenous, while streptomycin is given only intramuscular. These aminoglycosides will be given to 1 to 2 weeks, and usually we consider these aminoglycosides if there is relapse, to avoid the relapse because of lack of compliance of the patients. But we need only to take one aminoglycoside, doxycycline, either with streptomycin or with gentamicin. If the child is below 8 years of age, we will give cotrimoxazole, that is trimethoprim and sulfamethoxazole. The dose of trimethoprim is 10 mg per kg per day. The maximum dose is 480 mg per day. And the sulfamethoxazole dose is 50 mg per kg per day, with the maximum dose 2.4 grams per day. So the same duration of treatment will be 4 to 6 weeks, the same as the older children receiving doxycycline. We will give combination with cotrimoxazole, which is rifampicin, with the same dose mentioned before, 15 to 20 mg per kg per day, again for 4 to 6 weeks. If there is complication for brucellosis, including meningitis, osteomyelitis, or endocarditis, the option of the treatment will be doxycycline, gentamicin, and plus or minus rifampicin. You have to give these medications. What is the prognosis for brucellosis? With the specific therapy, deaths are only in complicated cases, as we mentioned, endocarditis, encephalitis, and so on, or meningitis. Then the prognosis after specific therapy is excellent. So if we give the specific therapy for the specific period, at least 1 month, 1.5 months should be given, six weeks. So if the patient, there is compliance, will be excellent prognosis. Here we will read a study. This is inside the green line and mostly in the between the Arab community. This is the abstract, the background. Brucellosis has become a major medical problem, particularly in the Muslim Arab population. The same in the Gulf countries. The methods. There were 88 children with acute brucellosis are described. This means that it is endemic and it is available. Why we don't have this number of cases? This means it is underdiagnosed, and we have to think if we find the triad we mentioned before. 67 of them were studied retrospectively during 1987 through 1988 for 2 years, and 21 of them children were studied prospectively during the year of 1989 to 1992. So these cases are significant. Epidemiologic, clinical, and laboratory features were evaluated, and the outcome of 4 antimicrobial regimes were compared, as we will see later. What are the results? The results, there were a classic triad of fever in 91% of children, arthralgia or arthritis in 83% of children, and hepatosplenomegaly in 63% of children. This is in most of the patients, so the triad is correct here. 61% of children had elevated liver enzymes because there is hepatomegaly and splenomegaly. Brucella melitensis, that is for goats and sheep, were isolated from 61% of blood cultures. And this is the proof, the best, for the diagnosis. But as we mentioned, it will take time. The relapse rate in patients who were treated with monotherapy was 43%, and this is high. So they tried with one group to give only doxycycline, but there were relapse for these patients, compared with 14% relapse with the regime of combined therapy. So the group given combined therapy, as we mentioned, doxycycline plus streptomycin, or doxycycline with rifampicin, or doxycycline or cotrimoxazole with rifampicin, the relapse rate was less. And this is important point. 11 children, that is 33% of children who were treated for 3 weeks had relapse, compared with 1 patient only treated for 4 weeks or longer. So the cause of relapse, mainly the duration of treatment. We told that should be 4 to 6 weeks. One given only 3 weeks, those were given only 3 weeks treatment, there was high relapse rate. The total relapse or reinfection rate was 20%. All patients with relapse recovered after the second course of antibiotic therapy, and this is very good. During the second year of follow-up, they did not stop, seeing the patients. So to be sure about these results and the outcome, there were follow-up for 2 years follow-up. So one child progressed to chronic osteomyelitis. What is the conclusion? The conclusions: combination therapy and extending treatment for 4 weeks or longer gave significantly better results than monotherapy or shorter courses of therapy and resulted in fewer relapses. This is very important conclusion. And from this study, really, it is clear that first lesson is we have Brucella endemic in our area. Number 2, there is underdiagnosis of cases. Number 3, which is recommendation for the doctors usually to keep Brucella in mind in any case of pyrexia of unknown origin, or if they find a triad of fever, hepatosplenomegaly, arthritis, or arthralgia. How we will prevent brucellosis? Effective eradication of the organism from cattle, goats, and other animals. Pasteurization of milk and dairy products. Strict clean and disinfect areas exposed to infected animals. Either it will be exposed to the urine of the animals, the blood or milk, or discharges, animal discharges. All these things should be disinfected. Keep sick animals away from other animals to avoid spreading the disease. This means isolation of the sick animals. This is very important, and we have to do health education for the people, or for the family who are having a case of brucellosis. We have to send, the health workers to see, to look to the animal pets beside the house, to advise them to keep the animal pets far from the house, to keep cleanliness. And again, it's very important to advise those people who are taking care with these animals to wear gloves, over shoes, sometimes gowns and hair cover and glasses even, who are taking care for the animals. In USA, there is a vaccination program used to control brucellosis in cattle. In cattle only, there is a vaccination started in the United States of America. These are the references. Any question regarding that, please you send any question to my email or through the messenger, and I will be happy to reply for any question from your side. So by the end of this lectures, every student will know about the Brucella organism. He knows epidemiology, pathogenesis, risk factors, clinical manifestations. He knows diagnosis, he knows treatment, prognosis, and he will know about the study in our area, and he will know the methods of prevention of this disease. Thank you very much, and see you in the next lecture.